Have you ever had a tooth that hurt so bad that it kept you up at night? Most times when you have a bad toothache, it's because an infection may be present. Most of the times when you have an infected tooth, you will have to either get that tooth extracted or have a root canal in order to help with the pain. Most people generally choose to have the tooth extracted. Although there are a couple of pros and cons that comes with having the tooth extracted, and that was what I will talk about with you guys on today. There are a few pros of having a tooth extracted. Number one, it is the easiest treatment to have done in order to take care of a tooth pain. Now, when you initially go to see the doctor, they will prescribe you an antibiotic and also a pain, of course, to get you comfortable. Now, if you do not come back to get that treatment done, that tooth will continue to get infected. You will continue to have pain. So that's why they encourage you guys to come back and get it done. It's why I say it's the easiest way to get yourself out of pain. Having a tooth extracted is so much cheaper than to have a root canal. This is generally why people choose that over a root canal. Root canals can cost you roughly $1,000 plus just for the root canal. And after you have the root canal, you got to have a crown on top, which is another $800. Meanwhile, you can get a tooth pulled for $100. So it's very cost efficient to go ahead and have the tooth extracted than a root canal. A doctor in Sweden actually did a study on whether patients choose the root canals or extractions. There were 85 patients total. They evenly divided between the sexes. There were 43 women and there was 42 men. And the average age was around 51. 48 patients had a tooth extracted and 37 patients had a root canal. So that kind of shows how most people generally do choose to have extractions over root canals. The cons. There are a few cons of having a tooth extracted. The first one is you now have a permanent missing tooth. Once you have a tooth removed, that's it. You only get one set of permanent teeth. So once you get that one tooth out, that's it. There's not another set growing. Which is why we truly encourage patients to take care of their teeth once they become permanent, because that's it. That's all you get. And most people don't know that teeth use the buddy system. Once you have a tooth missing, each tooth has a buddy on the side, of course. And once you remove a tooth, the teeth on the side are like, hey, what happened to my buddy? So they're going to shift to each other until they're touching again. Even from the teeth that's on top, they're so used to biting down and touching their buddy that when there's nobody there, they begin to grow downward and downward and downward until they touch a tooth. And eventually you end up having to get those teeth extracted as well because they have grown out of the gums. So that's definitely a con of having a tooth removed. And also, depending on which tooth it is that you have removed, it can be your smile line. And who wants to smile with missing teeth? So that's also a con that you have to think about when it comes to choosing extracting a tooth or a root canal. A maxillofacial surgeon wrote an article about a common complication after having a tooth removed. It's called a dry socket. A dry socket is defined as a post-op pain around the extraction site, which can happen anytime between the first and the third day after an extraction. Dry socket tends to hurt worse than the actual toothache. So we stress to our patients, do not smoke or spit or chew gum after you have a tooth pulled, because once that blood clot sits, we do not want to pull that blood clot out. Spitting, smoking, and chewing gum will mess with that blood clot, and then that leaves you with dry socket. And the only thing for dry socket is what we call dry socket paste, and it's the most painful thing, and they are not allowed to numb you. So you have to go through the whole process, and you have to feel it. If I do say so myself, that is a pretty large con to having a tooth pull. But this is why it is very, very important to take care of your permanent teeth. It's very important to floss at least once a day, and it's very important to brush at least twice a day. Believe it or not, it's more important to brush at night than it is to brush in the morning time. And once again, once you start having your teeth extracted, that's it. You don't get any more unless you want to pay. Unless you want to pay for more teeth, and that tends to be expensive, very, very expensive. So I hope you guys tend to take better care of your teeth.